The job description of a pediatrician encompasses much more than simply treating childhood illnesses. Pediatricians play a vital role in shaping the long-term health and development of infants, children, and adolescents. They are not only responsible for diagnosing and treating a wide range of medical conditions in younger populations, but also act as trusted advisors to parents and guardians. Their ability to manage both acute and chronic illnesses, provide preventative care, and guide healthy development makes them integral to public health. Pediatricians specialize in understanding the unique physical, emotional, and psychological needs of children. From birth through adolescence, they monitor growth patterns, administer vaccines, and offer insights on nutrition, behavior, and cognitive development. The job description of a pediatrician requires a high level of clinical knowledge, patience, empathy, and strong communication skills. In today's complex healthcare environment, pediatricians serve as key coordinators in multidisciplinary care, ensuring their young patients receive comprehensive and compassionate treatment. Whether practicing in hospitals, private clinics, or community health centers, pediatricians provide continuous and personalized care that evolves with the child's changing needs. Their scope of work is dynamic, influenced by advancements in medical technology, changes in healthcare policy, and new research on child development and disease prevention. Core responsibilities of a pediatrician. At the heart of a pediatrician's role is the evaluation and management of health conditions affecting children. This begins with conducting thorough physical examinations during routine checkups to assess overall health, growth, and developmental milestones. Pediatricians are trained to detect early signs of physical or cognitive delays and provide timely referrals to specialists when necessary. The job description of a pediatrician includes diagnosing and treating a wide array of pediatric conditions, ranging from common infections like colds and flu to more complex disorders such as asthma, diabetes, and congenital anomalies. They must be adept at interpreting laboratory results, imaging studies, and other diagnostic tests to make informed decisions about patient care. Pediatricians are also responsible for preventive care, which includes administering immunizations in accordance with national vaccination schedules. They counsel parents on essential aspects of child health, including nutrition, sleep, hygiene, behavioral issues, and injury prevention. By educating families, pediatricians play a significant role in fostering environments that support healthy development. Another core aspect of the job is managing chronic illnesses in children. Pediatricians monitor the progression of diseases like epilepsy, ADHD, or juvenile arthritis, coordinating with specialists to ensure integrated care. In cases requiring hospitalization, pediatricians may admit patients, consult with other healthcare professionals, and oversee inpatient treatment. Maintaining comprehensive and confidential medical records is a key part of their duties. These records help track progress, assess the effectiveness of treatments, and support accurate clinical decision-making. Pediatricians must also stay vigilant about public health issues, such as outbreaks of infectious diseases, and contribute to community health initiatives. Essential skills and qualities of a pediatrician. Empathy and emotional intelligence are indispensable traits in a pediatrician's toolkit. Dealing with sick or anxious children and their concerned parents requires patience, compassion, and the ability to provide reassurance under pressure. A calm demeanor and a friendly approach help build trust and cooperation, making clinical assessment smoother. Pediatricians must also be excellent communicators. Explaining complex medical conditions or treatment plans in a clear and accessible manner is critical. They must adapt their communication style depending on whether they're speaking with a toddler, a teenager, or an adult guardian. Listening attentively and answering questions thoroughly enhances patient satisfaction and promotes compliance with medical advice. Critical thinking and problem-solving skills are equally important. Children often present symptoms differently than adults, and it takes a skilled pediatrician to recognize subtle signs of serious conditions. Fast, accurate decision-making is crucial in emergencies or when managing rapidly progressing illnesses. Time management and multitasking abilities are necessary, especially in busy clinical settings. Pediatricians must juggle multiple patients, complete documentation, coordinate with nurses and specialists, and handle administrative duties, all while maintaining a high standard of care. Technological proficiency is also essential in modern pediatrics. From electronic health records to diagnostic tools and telemedicine platforms, pediatricians need to stay current with technological advancements that streamline workflows and enhance patient outcomes. Education, training, and career path. Becoming a pediatrician requires a rigorous and lengthy educational journey. Aspiring pediatricians must first complete a bachelor's degree with a strong emphasis on science courses such as biology, chemistry, and physics. This is followed by 4 years of medical school, where they earn a Doctor of Medicine, MD, or Doctor of Osteopathic Medicine, DO degree. After medical school, graduates enter a 3-year pediatric residency program. During residency, they gain hands-on experience treating children under the supervision of experienced pediatricians. They rotate through various subspecialties like neonatology, pediatric emergency medicine, and pediatric oncology to build a well-rounded foundation. To practice independently, pediatricians must pass a licensing examination in their respective countries. In the United States, this includes the United States Medical Licensing Examination, USMLE, and board certification from the American Board of Pediatrics, ABP. Some pediatricians choose to pursue further training in subspecialties such as pediatric cardiology, pediatric neurology, or pediatric endocrinology. These fellowships typically last 2-3 years and lead to additional certification. Continuing medical education, CME, is also required throughout a pediatrician's career to maintain licensure and stay current with the latest research and treatments. Work environment and challenges. Pediatricians work in a variety of settings, including private practices, hospitals, academic institutions, and community health organizations. Their schedule may involve regular clinic hours, but those in hospitals or emergency departments may also work nights, weekends, and holidays. Pediatricians who run their own practice also handle administrative and managerial responsibilities. While the work is rewarding, it can also be emotionally demanding. Treating critically ill children or delivering difficult news to families requires resilience and strong coping skills. Burnout can be a concern, particularly for pediatricians in high-stress or under-resourced environments. In addition to clinical challenges, pediatricians must stay informed about changing regulations, insurance policies, and public health guidelines. They often advocate for children's rights and equitable access to healthcare services, adding a layer of social responsibility to their role. Despite the challenges, many pediatricians find deep fulfillment in watching their patients grow into healthy adults. The long-term relationships they form with families create a sense of community and purpose that is unique to this profession. Conclusion. The job description of a pediatrician is far more complex and impactful than treating sore throats and administering vaccines. Pediatricians are dedicated caregivers, educators, and advocates who work tirelessly to protect the health and well-being of children from infancy through adolescence. They combine clinical expertise with compassion, ensuring that their young patients receive comprehensive, evidence-based care tailored to their unique developmental needs. From conducting routine exams to managing life-threatening illnesses, pediatricians are central to the pediatric healthcare ecosystem. The job description of a pediatrician also involves guiding parents through the intricacies of child rearing, offering them reassurance, knowledge, and support during every stage of their child's growth. As medical science continues to evolve, so too will the role of pediatricians. Whether through advanced diagnostics, telemedicine, or community outreach, they will remain vital to shaping a healthier future for generations to come. The job description of a pediatrician makes one thing clear. This is a career defined by dedication, knowledge, and an unwavering commitment to nurturing life.